Hello, everyone, and thanks for joining us today for our Older Americans Act Regulations webinar. It's in follow-up to us issuing a request for information. I'm Edwin Walker, the Deputy Assistant Secretary for Aging at the Administration on Aging within the Administration for Community Living within the Department of Health and Human Services. And I've been here at the Administration on Aging for 30 years. Yes, since 1992. And actually, one of the things I was hired to do back then was to draft Older Americans Act regulations in order to implement the act as it was reauthorized at that time in 1992 with the addition of the then new Title VII. Well, that tells you how my career hasn't gone exactly as planned. But we did develop draft regulations back in the mid-1990s. However, we weren't successful in getting them to the finish line, due in part to a change in approach from being compliance-oriented to being redirected to provide technical assistance to and in partnership with the Aging Services Network to collectively achieve success and to bring about continuous quality improvement. Through the years, we've used other vehicles to provide guidance, like state plan guidance or frequently asked questions, or even direct technical assistance and responses to inquiries. We've lived through many different eras, including the era of deregulation. Yet we have experienced multiple reauthorizations, and we've seen many program changes and challenges. All of this to say that now the stage is set to deliver a new set of guiding regulations to enhance programming, to reflect the evolution and changing environments in the field of aging, human services, and healthcare. So I want to talk a little bit about our process. Our process for achieving this is one that is reflective of our general approach. That is to be fully collaborative and engaging with you. So our request for information was designed to seek your input. The goal is to check and compare your input with the issues that we in the Administration for Aging and the Administration for Community Living have noted internally through the years, from the multiple engagements with our regional administrators and other program and fiscal staff as they have engaged with you. We wanted to talk about how we do this because we've given a lot of thought to it. And within the administration, we didn't want to move forward under the assumption that we have already collected all the issues, or that the ones that we have collected, that we have them totally right. So we really need to hear from you. You know, one of the key beauties of and a hallmark of the success of the Older Americans Act has been that it's designed to be reflective of local needs. And in that regard, we want to ensure that our guiding regulations are reflective of your needs. Now, let me conclude and indicate that I am so pleased that Amy Wyatter Rodriguez, our regional administrator for Region 5, located in Chicago, and who is also currently serving as the acting deputy administrator for the Center for Regional Operations, has stepped up and volunteered to lead and shepherd our regulations development process. I personally am so very grateful to her, and I'm pleased to present her to you now. Amy?
Great. Thank you so much, Edwin. Thank you for that overview and for your very kind introduction. I am so pleased to be working with you and other ACL colleagues and all of you on this webinar as we consider updating our Older Americans Act Title 3, 6, and 7 regulations. Again, I'm so pleased to be helping with this. And with that, we can move to the next slide. I'll note that we are recording the session and we will make the slides and recording available. And so to begin, let's start by going back in time and thinking about where were you in 1988. I hope there are some fun times to remember. But for some of our younger colleagues, they may not have even existed yet. For those of us who are old enough to reminisce about 1988, I've seen people remembering this as the birth year for children or grandchildren, maybe thinking about what grade or year they were in school, recalling some big hair and makeup and fashion, and for me at least, remembering some great 80s music. In terms of what was going on in popular culture in 1988, this slide contains some reference points in terms of movies, literature, music, and home economics. We can go to the next slide. Another way of getting into the 1988 mindset is to consider what didn't exist yet. Specific to our Older Americans Act programs, the National Family Caregiver Support Program was not a part of the Older Americans Act. The Americans with Disabilities Act was not law. Technology was certainly not where it is today, for those of you that remember cassette tapes and floppy disks. And pop culture figures of today, like the members of BTS, were not even born yet. Again, the reason why we're talking about 1988 is because that's when the current regulations for the Older Americans Act, Title III and VI, were last updated. We can go to the next slide. And since I'm not sure how familiar everyone is with the federal government lingo of laws and regulations, just to make sure we're all starting from the same place, this slide gives a quick overview. So the Older Americans Act is a law. This means that the Older Americans Act passed both houses of Congress and has been signed into law by the President. Individual laws are gathered in the United States Code, and a subsequent slide will have a link to the current Older Americans Act law text. Regulations, then, are rules made by federal agencies like ACL to guide the implementation of the law. Regulations are compiled in the Code of Federal Regulations, or you hear us talk about CFR, and published in the Federal Register. A subsequent slide will have the link to our current Older Americans Act regulations text. So you might think about this as the law gives an outline and the regulations help fill in the details. Please note that states also have processes for state laws and state regulations. Your state might refer to administrative code or administrative rules or have some other names for these two concepts. And as a helpful hint, if you're told about a requirement that a law or regulation requires, it's always a good question to ask if it's a federal or a state requirement. And in some cases, it may be both. We can go to the next slide. So when ACL sends notices of award, we include what the requirements are for each grant. There's an order of precedence or order of importance that is listed. And what's on this slide is typical for the Older Americans Act Title III, VI, and VII awards right now. This says that first, the statute or the law, which is the Older Americans Act, must be followed first. So if there's anything that says otherwise, the law or the Older Americans Act overrules that. Second are executive orders that would be issued by the President. And we'll talk about one such executive order in a bit. And third are program regulations, as highlighted on the slide. And for the Older Americans Act programs, this means the Older Americans Act regulations, which we're going to discuss further today. We move to the next slide, and that will contain a link to the current Older Americans Act law text. So this is where you can find the current Older Americans Act law that was passed by Congress and signed into law by the President, most recently on March 25th of 2020. We can go to the next slide. It will show the current 7 titles of the Older Americans Act law. And for the purposes of our presentation today, we'll focus on Titles 3, 6, and 7. Next slide. So one thing to note, and I'll probably say it again, just ACL can only issue regulations for what the law allows or authorizes us to do. And so the current regulations then, how to implement the law or what we are authorized to do, are listed here. So the first dot point is the set of regulations that gives requirements for the state, area agency on aging, and local Title III programs. And you'll see that 1988 date in the parentheses. The second dot point is the set of regulations for the Title VI Part A programs to serve elders. Again, the 88 date, as is in the third dot point, which is the set of regulations for the Title VI Part B program for older Hawaiian natives. Again, 1988. The final dot point is the set of regulations for the Long-Term Care Ombudsman program. You will note a different date here of 2015. ACL did issue Ombudsman program regulations in 2015, but other than changes relating to the Ombudsman program, no other regulation changes were made. And all of the regulations were updated in 2016 to reflect the creation of ACL and to consolidate the regulations in a single subchapter. But no changes to content were made at that time. So we can move to the next slide. And as Edwin alluded to, the Older Americans Act has been reauthorized many times since the Title III and VI regulations were established. It's actually been reauthorized 5 times since then. And because of that, this we'll just share some concerns on why you should care about the Older Americans Act regulations. So first, the current regulations don't line up with the law, which can be confusing. So as we said with the order of precedence, the law is what's most important. So that is what is followed. But again, the regs might not line up with that. So for example, the current regulations talk about a commissioner on aging, but the current law talks about the assistant secretary for aging. So we use the terminology that the law says. Another example is that the current regulations don't say anything about the National Family Caregiver Support Program because it didn't exist yet. So we follow what's in the law, but we may lack important implementation information. Another concern is that without current and valid regulations, there can be confusion in how to implement the Older Americans Act. Sometimes things that are written in the federal law might not be very clear when it comes to what does this actually mean and how does it apply at the local community level. Regulations can help us answer important questions on how we are to best provide services to older adults, elders, and caregivers. And without them, we may struggle to answer certain questions or know that we're being appropriately consistent in how we do things. Or maybe there are things in the regulations that are super outdated, like a 1980s floppy disk would be today. And if the Older Americans Act law is silent on those things, what is in the 1988 regulation still applies, even if it doesn't make sense with how we want to do things 30 plus years later. We can move to the next slide, and this is exciting. So we'll talk about the RFI process. And since ACL is beginning to consider updating the Older Americans Act regulations, I'll give an overview of the process steps. And again, we're so pleased and excited to kick off this process. So again, as I mentioned before, the ACL can only regulate what the Older Americans Act authorizes us to do. So per that order of precedence, we can't put anything in to the regulations that would conflict with what's in the Act. And additionally, we hope that it's not a surprise as I go through this process steps overview. There are detailed processes that ACL would need to follow to result in revising the regulations. So I'll talk about the steps. So first, our step where we are here today, we want to receive feedback from stakeholders. And when we say stakeholders, we mean tribes, villages, tribal organizations, states, area agencies on aging, local service providers, associations and advocacy groups, and others. We want to extend our request very broadly and widely. We may offer opportunities for listening sessions or verbal comments, like we may at upcoming conferences, or like we did at our Title VI program for our tribal aging programs last month. And please note that for transparency purposes, any sessions we have must be open to all, and any verbal comments should be followed up by written comments. Second, we're pleased to review in today's webinar that ACL is offering a request for information, or RFI, process in advance of issuance of a notice of proposed rulemaking. So the intent of the RFI is to give ACL feedback on what you would like to see as ACL drafts regulations revisions. And I'll go in a little bit more into detail with the RFI after I review the overall process. So if we go to the next slide, so what we gather from this RFI process and from what we hear from stakeholders through other venues will go in and inform then the notice of proposed rulemaking. So this is kind of the third step. This is the formal opportunity for review and comment of proposed regulations revisions. Written comments submitted as a part of this process would be given more weight than comments provided otherwise, as this is the very formal process to go through. And this would be an opportunity for Aging Network stakeholders and the general public to review and comment on whatever proposed regulations or regulations changes we would consider issuing. So after we go through that formal notice of proposed rulemaking period, ACL would review the formal feedback that we received. We would make any changes as a result of that, go through many internal reviews within ACL as well as HHS and elsewhere before issuing a final rule. Upon issuing a final rule, we would provide lots of training and technical assistance on how to make any updates or changes that would be required as a result of the revised regulations, including a time frame for implementation. You can go to the next slide. And so with that overview of the process, let's dive a little deeper into the RFI. So the RFI was published in the Federal Register last week, Friday, May 6th, and you can access the RFI on the link on this slide. Please note that feedback in response to the RFI should be submitted by Monday, June 6th. Next slide. As noted in the RFI, ACL seeks input from individuals and organizations regarding the services provided under Titles 3, 6, and 7, including supportive services, nutrition, evidence-based disease prevention and health promotion, caregiver, legal, long-term care ombudsman, and other services that are provided by the Aging Network and under the Older Americans Act. Next slide. We intend to be comprehensive in the feedback that we are seeking, including we would like to hear about challenges faced by older adults, elders, and family caregivers in receiving services under the Act, as well as challenges faced by states, territories, tribes, and tribal organizations, area agencies on aging, and service providers in delivering services under the Act. Next slide. Ensuring equity in Older Americans Act funded services is not new for the Aging Network. The Older Americans Act has long required that funding be targeted to those with the greatest social need. And ACL guidance has previously stated that while the definition of greatest social need in the Older Americans Act includes isolation caused by racial or ethnic status, the definition is not intended to exclude the targeting of other populations that experience cultural, social, or geographic isolation due to other factors. For example, in some communities, such isolation may be caused by minority religious affiliation, In others, isolation due to sexual orientation or gender identity may restrict a person's ability to perform normal daily tasks or live independently. And in January of 2021, the President issued an Executive Order 13985, advancing racial equity and support for underserved communities through the federal government. You can access the executive order via the text via the link on this slide. And the goal in advancing equity is to provide everyone with the opportunity to reach their full potential. And through this RFI, ACL seeks feedback on how Older Americans Act programs can advance equity in alignment with this executive order. Next slide. So now that we've gone through the details of the RFI, this slide gives some considerations and next steps for right now. And first is, have you reviewed the current regulations? Again, this slide includes the links to the current regulations. And one other thing I want to note is that given expectations for coordination among the various titles, we encourage individuals and organizations to review and comment on all as appropriate. So don't just restrict yourself to the one that you think that you work or know about primarily. We really encourage coordination and looking at our Older Americans Act programs holistically and as a system that we have out there to best serve our older adults, elders, and family caregivers. Next slide. So secondly, are there additions, deletions, or changes you would like to see in the current Older Americans Act regulations? A third consideration, do your various stakeholders or groups of which you're a member have additions, deletions, or changes they'd like to see in the current Older Americans Act regulations? And then finally, we encourage you to get your good thoughts and ideas down in writing and to please share them with us by sending them to the email address on the slide, which is oaa regulations@acl.hhs.gov. And if you can include OAA regulations in the subject line and send them to us by Monday, June 6th, we would be very, very grateful and appreciative. So with that, we can go to the next slide. And just again, we at ACL want to thank you so much for your care and concern for older adults, elders, family caregivers, and the staff, volunteers, and community stakeholders that comprise the amazing aging network across the country. We at ACL are so excited and energized to work on revising these regulations so that they can appropriately support the good work that the Older Americans Act makes possible. And so at this time, we can see if the technology will allow us to entertain questions or comments from those of you who are joining us today. And to do that, you can certainly, and we welcome you to enter your comments in the chat. You can also raise your hand. There's a little icon, at least on the bottom of my screen, to raise your hand. And that way we can go through and unmute you to ask your questions or make comments. And again, thank you. And we look forward to engaging with you all on this. All right. And so I am going to see, so we have one comment. Is there any thought of extending this June 6th deadline? It is a very short turnaround considering the pressures out in the field. Yeah, and I don't know, Edwin, do you want to take that or do you want me to?
Okay.
Sure. Yeah. So we reviewed, and in terms of the amount of work and review and processes, we certainly want to initiate and get started on this so that we can actually have a revision that we're able to get out there and implement. Certainly, this is not the only opportunity through the RFI to give feedback, but it's one that we are starting with. And so I don't know, Edwin, anything else you want to add to that?
No, that sounds perfect, Amy. And actually, I'm responding to some of the questions that we're getting in writing. So
perfect. Continue
right on.
Okay, wonderful. So another question that I'm seeing is, Marcia or anyone, if there is somebody who wants to ask a question verbally, please interject, and I'll just keep looking at the chat until we hear if there's somebody who wants to ask a question verbally. So there's another question. Do you recommend reviewing the law and the regulations and comment on the discrepancies? Certainly, that is one approach. However you would like to go about, reviewing the law, the regulations, as well as experiences that you've had in providing services or receiving services. We're not prescribing any particular way to go about that. Again, Edwin, anything you want to add?
No, you're great, Amy.
Okay, keep going. Okay, keep going. All right, another question. Is there a primary goal in this process? For example, creating more flexibility. I think there are multiple goals. One is making sure that the Act and the regulations are able to support implementation of the Act. And as we've said, because of the multiple reauthorizations since the regulations were last updated, there currently isn't a lot of alignment. Certainly, we would also, in areas where maybe creating more flexibility is possible, again, as we are authorized to do under the Act, we certainly would appreciate your comments and suggestions, recommendations on that. Yeah, we're very open. I don't know that it's one particular primary goal, just a lot of work that's overdue to really, again, make sure that the regulations can help support the implementation of the Act. Okay. Another question is there a reason that other titles are not included? For example, substantial changes and additions have been made to Title IV by the various reauthorizations. So with that one, I will say, number one, we need to start somewhere. The whole thing, like how do you eat an elephant is one bite at a time. We need to break off a chunk that we can start. That's where we can begin. And another thing to consider is that while there may be changes that were made for reauthorizations, we also see that the bulk of the appropriations, so in other words, the funding to actually implement things, is in Titles 3, 6, and 7, and so we are prioritizing and focusing on those titles. Okay,
Amy, I'm going to interject and I'm going to unmute Johanna. She has a question.
Great.
Johanna Schneider, if you can hear me, you can unmute yourself and speak.
Sorry about that. I was wondering if there has been any consideration into putting, and I understand that this would be quite difficult, but right now in the Older Americans Act, there is no table of contents or appendices or anything to help navigate this very long document. And it is difficult, at least at the state level, to be able to reference it. I know when we work with our community partners, there are times that they want to reference the Older Americans Act, and we have to go back through and say, where are you seeing this? We have to follow state policy. Let me review this and make sure that we're on the same page.
Yeah, so when it comes to actually making changes to the Older Americans Act, that would be outside of this process, because again, that's changing the law. So that's outside of this process. but certainly making comments in terms of perhaps regulations, making sure that they are easy to navigate. And again, the regulations are to help implement the Older Americans Act. We certainly would appreciate and encourage you to make any comments like that you think would be helpful for the regulations, if that makes sense.
Thank you, Amy. The next person I'm going to unmute is Karen. Karen, you can go ahead and unmute yourself and ask your question.
I'm sorry, I think my hand was up by accident, so please go on to the next one. Thank you.
Thank you for that. Okay, the next person that I'm going to unmute is Adam. Adam Willoughby, you can unmute yourself and ask your question.
Great. Thank you so much, Amy and Edwin, for this presentation. Very helpful. I'm Adam Willoughby from the state of California, and we look forward to submitting some comments. I guess my question is sort of like along the lines of the format of submission. So what I mean is that I think in one instance we could provide some explicit language modifying an existing regulation. In other instances, we have sort of identified topics for consideration, but not necessarily language, right?
Yeah.
We would think that, getting to the point of, agreeing on some language would be a deliberative process, and we're just not there yet, right? So we have one area where we could say, hey, here's some language to consider. And then we have other areas where we say these are areas of consideration that we'd like to dig into. So just wondering if you could sort of expand on that a little bit. Thank you.
Yeah, wonderful. Thank you for that question, and we welcome all of it. As much specificity as you're able to give, of course, we appreciate that, but we understand that there might be things too where you can identify this as an issue. I might not know how to resolve it, but yes, we welcome that all, and thank you for raising that point. I encourage everyone, with what Adam said, if you, no matter how detailed or if it's just more of a general recommendation, we welcome it all.
Thank you, Amy. I'm going to now unmute Nancy D. Miller. Nancy, you can unmute yourself and ask your question.
Thank you so much. I'm the executive director, CEO of an agency serving people who are blind. And
Nancy,
did we lose Nancy?
No, please unmute yourself again. I'm sorry.
okay, can you hear me?
Yeah, I can hear you now. Thank you.
Okay. We operate an older adult center that is funded through the Older Americans Act, and many of our staff are blind. I would like to share the PowerPoint and the regulations with them. Are you aware if those are accessible to staff reading through a screen reading software? Will they be able to access that information? And also, we offer 6 evidence-based programs. And one of the problems that we've encountered is that the training is not accessible for blind instructors. Is that the kind of feedback that you're looking for?
The answer is yes and yes to both of your questions. Yes, we're ensuring that the slides, the presentation will meet 508 accessibility. And yes, we welcome your feedback on the issues that you're encountering there. Thank you.
Thank you.
Thank you, Nancy. The next person I'm going to be unmuting is Trudy. Trudy, you may unmute yourself and ask your question.
Good afternoon. Thanks for taking my question. Oops, I got too much stuff on here.
Yeah.
I have recently started volunteering with agencies that work with older adults. And what we find is that a lot of seniors are really beginning to be frustrated because of the backlog. And I know that this is directly impacted because of the pandemic. Is there any way that we can really outreach and kind of say that the pandemic is really one of the reasons why we need increased funding for these multiple services, so that the seniors aren't as frustrated as they do when we're not able to give them the things that they need right away?
Yeah. So Trudy, getting some back feedback here, and I think it was a little bit hard to hear at the end, but I think you were referencing that the needs for additional funding, and absolutely that is something that we realize is a need and have heard before. However, the regulations process isn't really a process that affects the funding. That's something that would happen through an appropriations process. The regulations are more more geared toward how do you implement, what do you do with the funding that has been received, but it is not, changing the regulations will not have any impact on the funding that is appropriated for the programs. That's a different process.
Okay, thank you.
But definitely an issue. Absolutely. Thank you for raising that, and thank you for volunteering.
Thank you. The next person I'm going to unmute is Todd Coffey. Todd, you may unmute yourself. And I'm not hearing anything from Todd.
Try it now. Can you hear me?
Yeah.
So we are in the process trying to increase flexibility of our regulations in Colorado. And we're starting with the regulations because that has precedent over the policy and procedure. And I'm wondering if there was any consideration to start with the reauthorization of the Older Americans Act and then move to the CFR, because any flexibility is going to be contingent on the Older Americans Act supporting that change in the CFR. And if that's not going to be possible, if there's a way to make sure that there's not duplicative language in the CFR that exists in the Older Americans Act. And that way, if something does change in the Older Americans Act, we will be able to go in later and change the CFR. Since this happens, once every 40 or 50 years, I just want to make sure that we get it right the first time.
Yeah, a great observation. I think where we are is we have the law, what the current law is, and we are looking at regulations to implement the current law. If the law were to change in the future, that would be then a process then to go through and revise the regulations at that point in time to comply with the law. But I think it maybe would be premature to assume that the law is going to change or to know what the changes are. So we're kind of living in the reality of where we are right now. But definitely appreciate and again encourage you to share any feedback like that you have in terms of making sure that the act is appropriately flexible where you think it should be, appropriately prescriptive where you think it should be.
Thank you. And it looks like we have a question from Chris Grant. You can unmute yourself and ask your question.
Sorry, that was an accident for my hand to be raised. Thank you.
Thank you. Okay, and looks like we have another question from Dabney Connell. You may unmute yourself and ask your question.
Thank you. I was asking if we could put the OAA reg links into the chat so that we could have access to those before the PowerPoints go live within the 14 days.
Yes, let me see if I don't know, that's something that I'm not sure, maybe Nicole or Chris, would you be able to help with that? Thank you.
I can put the links up, as well as we are able to send out the PowerPoint to attendees today. we can send that PowerPoint out. However, the transcripts and the recording will not be available just yet. So please be mindful of that. Just the PowerPoint will be sent within the next 24 hours.
Awesome, thank you.
It looks like Jeff beat me to putting the link up. So the next person who has their hand up is Sarah. I'm going to unmute you. You may ask your question.
Can you hear me?
Yeah, go ahead, Sarah.
Good morning from New Mexico. Just looking at all the postings and the announcements about these regulations review has really had me thinking about a lot of things. As a service provider, we do what we can to make sure that we're following the regulations and the guidelines, but to make sure that I'm understanding this correctly, what you're asking for is feedback on, how we can improve operations and expand services with regard to the regulations, correct?
I think that's a good way, yeah, of putting it.
Okay, and I'm just trying to get some clarity because I know a lot of tribal providers, I don't know how many are on this call, but they seem to get intimidated by things like this. And when we come together, we all talk about the challenges that we face and, the obstacles that some of these regulations create. And I just want to make sure that if they're on, they understand it.
Yeah.
And I know one of the things was lowering the age eligibility. We've been trying to work with the state, and which they did, but no additional funding was provided to accommodate the age, lowering the age eligibility. There's just a high rate of health disparities in Indian country, especially in rural areas, that it's really hard to meet the stated age within the regulations because, a lot of our elders, unfortunately, because of these health disparities, don't make it to that age. So we're looking at the way I've understood this, I've been doing this now for 8 years, is that this Title VI program is really more so a prevention method for elders who are of age to receive services. But I was really looking at something more towards intervention at a younger age to help our elders reach, 60 and older, because that's one of the challenges we face. And I've done my best to be a good advocate, but I just want to make sure that this request for the feedback on the regulations had to do with some of those issues that we talk about.
Yeah, thank you so much for those comments, Sarah. I think, I was trying to write notes, a couple of different things that you said. Number one, we don't want anyone to feel intimidated by the comments that you submit. So please, we like plain language too. If you can identify a problem or something that you've talked about with your peers or colleagues, you don't need to make it fancy or flowery. You can just let us know that. Of course, if you want to make it fancy or flowery or put a lot of detail in, we're happy with that too. Mostly, we just want your feedback. We want to know what you're thinking and what your concerns are. Secondly, we want to know your thinking and your concerns. And I guess I would encourage you to send those to us. But again, note there are some things that we may not be able to change, again, because there are things that are in the act. So we can't change the law in this process. And so, things where maybe there are age requirements or other types of requirements, we may not be able to change. But I think I don't want to create a barrier of being like, well, I'm not sure. What are those? So just send that feedback to us. But just recognize we may not be able to make the changes recommended, but I think it is still helpful for us to know what it is that you would like to see changed.
Thank you. One more thing is that I really, when I first came into this position, it was kind of like being fed to the wolves. I had no idea where to start. And of course, we start at the regulations, but I think having continued open dialogue with people such as yourself, with also with Edwin, and really review these regulations more often rather than every so many years would really be more assistive than waiting until, I've been here 8 years, and this is the first time that we've really been presented this opportunity. But at the same time, working with our tribal leaderships, I would really prefer methods such as, I guess at this time we can't because of the pandemic, but more tribal consultation, one-on-one tribal consultation with individual tribes, just to kind of give them the opportunity to voice their concerns and some of the challenges that they face. But that's just another thought. But we will be sending something. I'm from the Pueblo of San Felipe in New Mexico, so I'm working with my tribal administrator as well as the governors to send in a response. But thank you for this opportunity. And Edwin, it's good to see you. And you just gave away your age by telling me how long you've worked for ACL. Thank you.
Thank you so much.
Thank you.
Thank
That
you,
was
Sarah.
the last person that had their hand raised. However, their chat has quite a few questions that we could continue to answer, and as well as the question and answer section. If we can get to the chat section first, only because I can copy the question and answer section to possibly do a transcript to respond, but I cannot copy the chat. So
yeah, absolutely. Yeah, I've got one up that I can go to, or do you want to read through, Nicole?
You can keep moving forward. I think you had a pace there.
Okay, all right, wonderful. So I see a question from Amanda. How do you recommend we structure feedback for the National Family Caregiver Support Program policies without an existing CFR specific for that program? Would a Word document with challenges, recommendations for additions, or clarifications be appropriate? Yes. That sounds great. Yeah, and as I said before, we appreciate as much specificity and detail as you're able to provide. But if all you have, you have just general things and don't really have that specific detail, we welcome that, and we welcome whether it's in a Word document or Excel. I'm happy to we're happy to review that. Whatever format I think works for you, we appreciate that. Okay. All right, so I see a comment from Lori, would support language change to move from client cost share to recommended sliding contribution scale. Again, share your feedback, share your recommendations, but recognize that there may be some things that are in the statute that, again, we can't conflict with, but certainly want to see how we might be able to, best implement the law in the regulations. Let's see, I think this was Johanna's comment about the table of contents. I'm going to move along. Are you seeking input on senior core as well? I believe specifically that would be outside the context of Title 3, 6, or 7. However, if you have comments that maybe are about coordination with Title 3, 6, and 7, I'm not sure what the feedback you might have. So as long as it's relevant to Titles 3, 6, or 7 of the Older Americans Act, yes, we welcome that. Let's see. A question from Melanie, is ACL going to be keeping track of the changes sought that cannot be made in the regulation because of the limitations in the Older Americans Act statutory language? I think, yeah, that's a great point and something that we've talked about internally. Like, this might be good to help us understand what things the network might like to see in a future reauthorization. Let's see. Anne is asking, interested in hearing if other state units on aging are working collaboratively with the long-term care ombudsman or other agencies to submit one set of comments from multiple agencies, or if most states are encouraging partners to submit individually. And again, we're happy with all of the above, whatever coordination you would like to do, or if you want to do things individually, or both. I've heard from at least one aging network partner that that may be the option, is that both things are pursued. Let's see. Okay. Michael is noting, with the major disaster declaration, there was more flexibility in program like Title IIIB for services like grocery bags to address food scarcity and Title IIIC for home delivered meal options. Despite many of the relief packages, our nutrition providers are struggling with administrative costs. We are concerned about sustaining these rates and requests for increases beyond federal fiscal year 24. As again, kind of this is one of those areas where the regulations aren't able to address appropriations. Appropriations is getting money for the services and the programs, and this isn't the process for that. That would be the appropriations process. But certainly if there are considerations related to experiences that you had through the major disaster declaration, or some of the innovations and new service models or new services that were provided that you would like to see continued, enhanced, addressed in the regulations in any way, those are some perfect examples of things that we also would like to hear from you on in terms of your feedback for the regulations. Okay. Oh, and sorry, and can flexibility in the regulations process provide more flexibility for some of these funding issues as experienced during the pandemic? I think, yeah, just kind of as I said. Would recommending lowering the age, this is from Lynn, would recommending lowering the age eligibility requirement for the grandparents and relatives as parents be appropriate in this process? Again, certainly sharing any feedback, but recognizing there are things that may be in the Older Americans Act law that set certain age requirements that we would not be able to change through this regulations process. Okay. I'm seeing the link for the regs. Okay, going through that. Blake says, please make sure that any changes flow forward to the A133 compliance supplement. Great comment. Okay. Let's see. Question from, oh, go ahead, Edwin.
And I was just going to say there was a similar or related comment in the question and answer, which I answered in writing.
Perfect.
But it related to, were we going to include aspects from our fiscal guidance? And the answer is clearly that we are looking to have fiscal guiding regulations as well during this freeze.
Absolutely. Great. So Amanda is adding on to the question regarding evidence-based leader curriculum not available for people who are blind. If a curriculum did not meet ADA compliance, would ACL be responsible for regulating the organization that created the content? And how would that affect other providers from delivering that program? I think those are concerns and questions that if you have thoughts, suggestions for us on that, again, we very much would appreciate your feedback on that. Again, the regulations are really how to implement the law. So any of those types of implementation considerations are things that we are very interested in hearing your feedback on. Let's see. There is a question on, will questions, ideas, comments submitted in the RFI be publicly available? And that is one I'm not sure exactly on. I don't know, Edwin, do you know the details on that? I believe we address it, but I just don't remember at the top of my head.
I think the answer is that the actual comments are not going to be publicly available, but when we respond with regard to our preamble in our notice of proposed rulemaking and certainly in our final rule, we'll be summarizing the types of comments we've received so that they will be categorized.
Great. All right, and then a question from Tina. Does ACL have a proposed time frame for releasing the revised regulations for these titles? And Edwin's laughing, I knew he would, because a lot of this is quite honestly out of our control. Like I mentioned, we have to go through review processes internally within ACL and HHS and others. And so we are working as quickly as we can to do this, and being mindful of, we want to get feedback. We need to do these steps in the process, but in terms of being able to give a date, that is beyond our control. As soon as we know any updates and things, we certainly will share them. Any steps in the process as we go through, any updates that we have to that, we will share them as quickly as possible. Lynn is asking, how do you intend to approach the National Family Caregiver Support Program since it did not exist in 1988? And I think we want to approach it based on your feedback, based on your comments. Certainly we'll also base it on our experiences and our thoughts, things that have come up to us. But this is one of the things we definitely want to hear from you on, and we need to hear from you on, so that we can do it justice. And Michael is commenting, good question, on National Family Caregiver Support Program. They had a discussion how they could expand coverage for adaptive technology and other supplemental services, given many seniors are still not attending senior centers. Again, welcome that kind of feedback. Exactly. Those are the types of things that we want to hear about. How can the regulations help guide implementation of the law based on our experiences and where we are right now.
Amy, it looks like we're getting to time.
All right.
Yeah, so many questions, so many great questions. I have been able to record the questions in the question and answer sections, so we can at least write a written response for those questions. And again, we can send out the PowerPoint. However, the recording and the transcripts will not be available just yet. So we will send links for those as well.
Great. And so I guess, Edwin, you want to have the last words here, just thanking everyone?
Sure. I definitely want to thank you all. This has been a tremendous turnout. Thank you for the questions. Continue to send us information. That's what the request for information was all about. As I indicated from the very beginning, we cannot do this, or we don't want to do this without you. We want to be reflective of you and what you are experiencing as program administrators and individuals dedicated to the field of aging. And we're all doing this on behalf of older people to improve their lives and their quality of life. Thank you again so very much. I have to thank you, Amy. You did a tremendous job. Thank you, Nicole, and all the support folks. Thank our CART person as well. Thank you so very much, everyone. Have a great day.
Bye.